are seen as a key indicator to how countries are dealing with the coronavirus pandemic. Take a look at this chart comparing the mortality rates of people infected with COVID-19 in various European countries. So why, compared to elsewhere, are so few of the Germans diagnosed with coronavirus dying? Here are the main theories. Testing. Aside from getting people diagnosed and on appropriate treatment, testing is helping us establish how widespread the virus actually is. German health officials say they began testing people even with milder symptoms relatively early on, meaning people with less serious infections may make up more of the confirmed cases in Germany than elsewhere.
Cases have resulted in death in Germany, compared to about 10% in both Italy and Spain. But how much should we be reading into these figures? Analysis into why Germany's death rate is so low usually points to the country's rigorous testing system. And it's true to say that Germany was quick off the blocks. The country developed a test for the coronavirus back in January, weeks before it recorded its first case. Germany now carries out about 500,000 tests each week across a vast network of laboratories. Mass testing has enabled German authorities to detect mild and asymptomatic cases, which might go undetected in other countries that don't have the same testing capabilities. A country's COVID-19 death rate is a calculation of the number of known deaths out of the total number of known cases. So if Germany is able to detect more mild cases, then this would effectively lower its death rate. Conversely, if Italy struggles to record mild cases, this would inflate its death rate. German authorities are cautioning not to get carried away with the current death toll compared to others. Here we show the death toll increase in Italy, France, Spain, the UK and Germany from the moment that each country recorded 10 deaths. On the 18th day after each country reported its 10th death, this is what we find. Italy, 1,441 deaths. France, 1,331. Spain, 3,647. UK, 1,408. Germany, 1,107. While Germany's numbers are still lower, they're not as low as the relative mortality rate suggests. Adding to this is the fact that the virus appears to have infected a younger section of the German population. More than 70% of those infected are aged between 15 and 59. That's not to downplay Germany's capacity to deal with the crisis. When looking at the number of hospital beds, for example, Germany has 6 acute care beds for every 100 patients. France has 3.1. Italy has 2.6. Germany has even been taking in critically ill patients from Italy and France, where hospitals are overstretched. The German government also aims to increase its stock of ventilators to 35,000. In comparison, France has around 7,000 and Italy has about 5,000. But authorities warn that in a country where a quarter of the population is over 60, now is not the time to get complacent. The number of cases could spike, and hospitals could soon be overwhelmed.
But at present, not all countries are testing in the same ways. The differences between countries' approaches may account for some differences in the mortality rates. Italy or Spain's rates, for example, might be lower if a broader cross-section of the population were being tested. In the race to respond to the virus, countries in Europe did not begin on an even footing. According to data from the Organization for Economic Cooperation and Development, Germany has 6 acute care beds for every 1,000 people, compared to France's 3.1, Italy's 2.6, and Britain's 2.1. In total, Germany also has around 28,000 intensive care beds, about 2.5 times more than Italy. Arguably, that's given Germany an advantage in coping with severe COVID-19 cases. Outbreak timeline. In terms of the outbreak, it's believed the virus spread in Italy sooner than in other European countries, possibly due to the northern Italian textile industry's strong economic ties to China. Italy began seeing significant transmission of the illness some 2 weeks before Germany, meaning the virus has had more time to spread and for a greater number of serious infections to run their course in patients. Another theory suggests that Italy's higher death rate is linked to a higher rate of infection among older people. After all, the virus appears to carry a greater risk of death for older patients, and the spread among Italy's elderly population could relate to living norms. UN figures show that in Italy, several generations living under one roof is more common than in Germany. 27% of Italians over 60 live with their children, a percentage 4.5 times higher than Germany's. So whether it's due to Germany's testing capabilities, its healthcare capacity, the timeline of the outbreak, or cultural differences that have resulted in a slower spread among the elderly, mortality rates due to COVID-19 in Germany remain comparatively low for now. Experts stress, however, that the epidemic appears to be far from over, and much of the data on COVID-19 cases